Hi and welcome everyone. Today I have the pleasure of interviewing Scandion Oncology's CSO, Jan Steenvang. Jan, thank you so much for doing this interview.
Thank you. It's my pleasure being here.
Great. Now let's get to SEO 101's mechanism of action, which is based on efflux pump inhibition. Can you just elaborate a little bit more? How does that technology work?
Yes, of course I can do that. And for that purpose, I brought a single slide here. So it's important to realize what's going on in the normal situation when a cancer patient receives chemotherapy. You can see here we have depicted a cancer cell, and the blue color indicates that chemotherapy builds up inside the cancer cells once it's added to the patient. That's good because we need chemotherapy inside the cancer cells to kill the cancer cells. What you will also notice is that we have a Pac-Man-like symbol below the cancer cells. That's the enzyme UGT1A1, which inactivates chemotherapy. What happens very often is that drug resistance emerges in the patients. This may happen because an efflux pump is upregulated, for instance, ABCD2, which is depicted in red here. It's in the membrane of the cancer cells, and it pumps out the chemotherapy. So you can see that the chemotherapy inside the cancer cells is reduced, and thereby it's less likely that the cancer cells is killed. It's therefore resistant. Still, you have the UGT on the outside of the cancer cells inactivating the chemotherapy. So this is a bad situation where the chemotherapy is not expected to be very efficient. What then happens when we add SCO 101 into the system is that we have a dual mechanism of action. One part is that we inhibit the ABCD2, restoring the chemotherapy inside the cells. At the same time, we inhibit the UGT1A1 enzyme outside the cancer cells, so we will have more chemotherapy outside the cancer cells. So we have a dual targeting mechanism of action leading to more chemotherapy inside the cells, more chemotherapy outside the cells, very likely leading to increased killing of the drug-resistant cancer cells.
Perfect, very interesting. Now, can you talk a little bit more about how does this approach differentiate itself from the current standard of care, for example?
Yeah, that's a good question. Thank you for that. There's two mechanisms, as I just explained. So if you take the efflux pump part first, so this is not conceptually new. It's not a novel approach as such. And there's also some currently approved drugs in oncology and also outside oncology that inhibits efflux pumps, although these drugs were not specifically developed to inhibit efflux pump. One example is the Gleevec, which is a kinase inhibitor. It's a blockbuster. And that has been shown in detailed preclinical studies to inhibit ABCD2. And it's also been shown to reverse resistance to irinotecan in cancer cells. It's also currently being investigated in clinical trials where they look at, in cancer patients, where they look at the associations between mutations in ABCD2 and the effect of Gleevec. So that is for the efflux pump. So conceptually not novel. The efflux pumps, they are comprising of a large family of proteins, and previously there's been a lot of trials targeting one of these efflux pumps. It's named ABCB1. These inhibitors were tested in phase 3 clinical trials. However, based on combined conclusions on the toxicity, maybe the suboptimal clinical designs, and also the lack of sufficient efficacy, these ABCB1 inhibitors was largely abandoned. However, ABCD2, as SCO-101 is targeting, has not really been explored to any large extent in clinical trials. So in that sense, it's new to target ABCD2 in clinical trials. For the other part of our mechanism of action for the UGT1A1, this is also not a novel concept in itself. It's well known that metabolic enzymes can be targeted, thereby improving the effect of other drugs. Actually, in colorectal cancer, this concept is used. As I said, the patients we have included are treated with FOLFIRI. That consists of irinotecan, 5-FU. These are the chemotherapies, But then there's a third component, is leucovorin, and that actually improves the effect of 5-FU. So the concept is already used in the patient group we are addressing. Also, Lonsurf is approved for treatment of metastatic colorectal cancer patients, and that builds on the same principle that a drug makes the other drug better. It's also applied in HIV, COVID-19, Parkinson's disease, for instance. In HIV, there's two drugs named ritonavir, cobicistat, that are approved. So they also improve the power of protease inhibitors and integrase inhibitors in HIV. So it's a well-known concept. So the two individual mechanisms of actions for SCO-101 is as such well established in oncology and outside oncology, however, differentiates itself by doing it simultaneously.